New year, new you means Transformation Tuesdays are back. Today we're putting a spotlight on rhinoplasty, which is commonly known as a nose job.
Yeah, I got the chance to visit our friends at Somenek, Pittman, MD, and actually headed into their OR with board-certified facial plastic surgeon Dr. Michael Somenek. Take a look. Transformation Tuesday on Good Morning Washington is sponsored by Somenek, Pittman, MD. And we are back in the OR with Dr. Michael Somenek. I love being able to get into the scrubs and come chat with you.
You wear them so well.
Thank you. I feel like I belong in them. Today we're talking about a really interesting topic, and that's rhinoplasty. For those of us at home that may not be familiar with it, what exactly is rhinoplasty?
Yeah, so rhinoplasty is commonly referred to as a nose job. I think that's what most people call it. And it's basically a surgical procedure that's designed to enhance some of the cosmetic aspects of the nose, but in some people they also want to address some of the functional breathing components of it as well.
This is a very specific to each patient type procedure. Why would somebody seek out rhinoplasty?
There's so many reasons why they come to a rhinoplasty consultation. I think the main one is the cosmetic component. They want their nose to look better. So whether it's the hump on their nose, or they don't like their tip. It's either too droopy, it's too bulbous, or it just doesn't have the shape. So that's the main reason why. But then also the functional breathing side. People also have nasal obstruction that may or may not be able to be fixed during their rhinoplasty. And so part of the consultation with me is I look in your nose to determine, is there a functional component that I can address as well to not only make the nose look better, but make you breathe better?
I know you've seen a lot of patients that have had revision rhinoplasty. Why would somebody get a procedure done twice?
Yeah, I think when people come in for a revision consultation, most of the time they're not happy with the cosmetic result they got from their previous surgery. So that can involve little minor asymmetries. Maybe they have breathing issues as well. And so those two things, again, you really need to break it down to determine, number one, are their expectations in line with what can be delivered with a potential surgical result to get them where they want to be.
We're here in the OR right now at Somenek, Pittman, MD, the private OR. Talk a little bit about the recovery process, what that looks like.
Yes, so your rhinoplasty is done here at our private surgical suite. It's outpatient, so you go home the same day. You have a cast on your nose for 1 week. So we see you at 1 week, we get the cast off. It's very liberating because your breathing improves, and you can appreciate the beginnings of your final result. So I always tell my patients, yes, your profile is going to look better, the tip's going to look more refined, but it's by no means going to be your final result. And rhinoplasty is kind of a journey afterwards. And so week after week, you're going to notice continued improvements to the nose as the swelling resolve and you get more definition.
I've so enjoyed this conversation. I've learned so much, but there's a reason for that. You've had fellowship training in this, and you specifically have trained just in this topic. Why is it so important when someone's seeking a doctor out to find somebody just like you?
Yeah, I think specifically for rhinoplasty, it's so important to find somebody that specializes in this and specifically receive training. I mean, think of it, the nose is the centerpiece of your face, so you want it to be done well, and you also want someone that does many of these per year, that it's common for them. And for my patients specifically, when you come in for a consultation with me, I do three-dimensional imaging with you. So we take a picture of your face and your nose, and we simulate what a potential surgical result can be from a rhinoplasty when you sign up with me. So I really think that that helps give you a visual as the person sitting in the chair of what to expect afterwards. And also with specialized training, I learned different grafting techniques to really strengthen the nose. So your nose is a stronger version of itself after the surgery.
Thank you so much, Dr. Somenek. Great to see you.
Yeah, likewise.
It's just so incredible, and again, every time I'm there, I learn something new, and the comfort level that comes from being with them, and that's how they are with all of their patients. They are just so personable, one-on-one. You can ask questions, you feel comfortable asking questions, and that's how you should feel.
Yeah, talked you through every step to make you feel comfortable, and also normalized it. You don't have to live being uncomfortable or unconfident. You can just, go to the experts.
Yeah. And they are the experts, and that's why we love them on Transformation Tuesday. They're here every Tuesday.